So it is Tom. He's going to share himself speaking. Tom is a grassroots organiser and an author on immigration, anti-racist politics, and a contributor to Fight Racism, Fight Imperialism. So please welcome Tom. Take it away, Tom.
Thanks, Ruby. I ended up recording this earlier so that otherwise I'll be exhausted for the start of the questions and discussion. So I'll put this on. I've been asked to talk about why Britain has fared so badly during the pandemic. Tens of thousands of lives have been lost unnecessarily. Tens of thousands more are suffering with severely limiting long-term health conditions arising from COVID. Millions of people have been pushed into greater financial hardship and into levels of social isolation whose full consequences won't be known for some time. Any hope of transforming this situation has to involve an analysis of why the government has handled this so badly and what the range of options are for any capitalist government in Britain. This has to start with the underlying context, which is British capitalism's long-term crisis and decline, and the various attempts the ruling classes have made to prop up Britain's fortunes, which have come together in a perfect storm to intensify the impact of the pandemic beyond what most countries have experienced. These include the creation of a massive industry for outsourcing services from the state to the private sector, the structural reliance on super-exploited and temporary migrant labour alongside highly mobile business elites, the creation of an increasingly punitive and conditional welfare system, the weakening of labour enforcement, the growing reliance on private rented housing for the working class, and the changing funding regime for universities. Then we will come to the violence that has been inflicted on the NHS and social care system in recent decades, and the government's reliance on a reactionary populist base. A lot of the longer term issues that I'm going to be talking about are discussed in more detail in my book, Borders, Migration and Class in an Age of Crisis, which the RCG has copies of available for a discount. I'm going to use some slides mainly for those parts of my talk where there are numbers to present, as well as some images of resistance. Let's begin with some context. We're living in a period of long-term capitalist decline, rooted in an overaccumulation of capital. Under capitalism, wealth will only be invested if it promises a greater return on the amount invested. And so with every successive round of investment, the total sum of capital grows ever larger and requires more outlets for profitable investment. Overaccumulation of capital is such that by autumn 2014, corporates and private equity firms globally held $7 trillion in cash for which they could not find a profitable outlet, with £53.5 billion just among the top 100 companies on the London Stock Exchange. The search for new places to invest all of this capital, which has become increasingly desperate as the crisis of accumulation has intensified, has driven imperialist expansion, the ruthless appropriation of the natural world, and privatisation and outsourcing. Britain's economy is reliant on wealth that is drawn in from overseas investments, unequal pricing regimes, and via the financial sector in myriad ways, including returns on loans and the export of financial services. In 2019, Britain's external assets, its foreign investments, totaled more than £11,000 billion, which was more than 5 times Britain's gross domestic product. Rates of return from foreign direct investment, which accounts for around 10% of Britain's total overseas assets, were 9% from investments in Africa and 13% from investments in Asia in recent years, compared to 5% from investments in Britain and the north of Ireland. Such profitable conditions in Africa and Asia are created through weaker environmental and health and safety controls and lower wages, enforced through repression by these countries' states, often acting in collusion with the government of Britain and other imperialist countries. This plays a vital role for capitalism, sustaining the average rate of profit and providing capitalists with sufficient incentive to invest and keep accumulation going. Britain is highly dependent on the import of goods, with a net deficit of £130.8 billion in 2018. That's importing £130 billion more than Britain exports in goods. And British capitalism finances this deficit to a great extent through the export of services, which had a net surplus of £100.3 billion in 2018. The reliance on international investments leads to competition between the major imperialist powers. Britain's declining capacity to defend its investments against its rivals has forced the ruling class to make a choice between joining one of the major imperialist blocs, either the EU or US. This has been resolved for now by Brexit at the cost of further weakening Britain's international influence and making it a subservient partner to US imperialism, which is itself in decline. This context has affected the response to the pandemic in multiple ways. The ruling classes have responded to Britain's declining international position by cutting back on state welfare and pushing increasingly wide sections of the working class into a more precarious position to make it easier to force down wages. This has denied working class people both public and private resources with which to cope with the pandemic. Inter-imperialist rivalries have undermined international cooperation, while Britain's reliance on service exports has encouraged outsourcing to the private sector wherever possible. Now, a lot of people are rightly angry about the completely ineffectual track and trace system, which has been mostly outsourced to the private sector. This too has its roots in the crisis of British imperialism. Outsourcing public services has been driven by the need for British imperialism to find new opportunities for profitable investment. By opening up services that were previously provided by the state and fostering the emergence of new multinational companies through public contracts. Outsourcing is therefore a form of capitalist plunder, the precedent for which was set by the wholesale privatisation of state utilities and industries over previous decades. Public sector outsourcing was first introduced from the late 1980s and was significantly expanded by the Labour government after 1997. Powerful lobbying organisations were created in this period with close links to government and the media to push the outsourcing agenda. Companies sponsored research to promote outsourcing and in some cases set up their own research institutes. By 2014 to 15, 1/3 of British government expenditure went to external suppliers, totalling £242 billion, including around £100 billion for outsourced services. To give some context, this compares to a total wage bill for the public sector employees that year of £194 billion. The activities of companies like G4S and Serco have become a lucrative source of profits for British capital and a provider of investment opportunities because of their role in service exports. This explains why British governments have consistently defended these companies and continue to grant them contracts despite numerous embarrassing failings, from the botched Olympic security to companies that have claimed for electronic tagging of deceased prisoners, and outright abuses such as the racial and sexual abuse by guards at Yardswood Detention Centre and the killing of Jimmy Mubenga by outsourced immigration guards in 2006. Outsourcing is particularly attractive to capitalists because there is no risk to them. The state acts as guarantor for investors' interests, no matter what. Another aspect of Britain's parasitic relationship with other countries involves its structural reliance on super-exploited migrant labour, enforced through racist immigration controls. And this too has played a role in the pandemic. Over recent decades, the British ruling class has tried to meet its labour demands in sectors like agriculture, food processing, social care and construction with temporary migration, where people have limited rights to stay and are therefore less likely to be in a position to resist. Alongside this, the international mobility of technicians, managers and investors has been accelerated to meet the needs of global business. All of this is important to bear in mind when we consider the government's reluctance to take public health into account in its approach to border control during the pandemic, with little or no arrangements for quarantine, because this is what capital has demanded. An initial attempt to impose limited quarantine requirements last summer was quickly watered down following protests from business. While the government has continued to operate charter flights to deport people from Britain during the pandemic, last summer it also organised charter flights to Britain from Romania to bring in agricultural labour. This should remind us that capitalist borders are not about stopping people moving as such, but rather about disciplining workers to move in ways that benefit capital. The NHS surcharge for migrant workers remains in place, and because access to the vaccine requires an NHS number, many people will be excluded because they cannot pay the surcharge or are undocumented, harming both them and those around them, and creating the risk that unvaccinated pockets of the population will remain, from where the virus will be able to keep returning to the wider population. This is the murderous, hostile environment at work. Beyond the particular conditions of exploitation that face migrant labour, the ruling class has also increased labour discipline across wider sections of the working class in recent years, in an effort to tackle the capitalist crisis by forcing down wages, using conditional state welfare as a mechanism to terrorise people into accepting work no matter how bad the conditions and no matter how low the pay. During the pandemic, this has had serious implications for people's ability to isolate properly when they need to. Benefit sanctions were first introduced as part of the Labour government's New Deal after 1997, whereby a person's benefits could be suspended if they refused what was called reasonable employment. Their use increased significantly from 2007, and penalties were made more severe in 2012. A Freedom of Information request in 2017 revealed that staff who were assessing the first stage of appeals against sanctions were given a target of rejecting at least 80% of those appeals. A further plank in this workfare regime came with the 2008 Welfare Act that introduced the notorious work capability assessment delivered by outsourced private companies. Disabled people have come under particular attack during this period because the allocation of resources to people based on their needs is an implicit threat to the attempts by the ruling class to tighten labour discipline and make people operate only according to the needs of capital. During the pandemic, this conditional welfare system that had been developed in previous years has combined with insecure employment, inadequate sick pay and a lack of savings among the working class to make it impossible for many to isolate when they need to. While grants of £500 have been made available in theory since the autumn for people needing to isolate, this is only available for people on certain benefits and requires a letter from the employer saying that the individual cannot work from home. In the initial period of implementation of this, 80% of those who applied were refused. This creates a disincentive for poorer sections of the working class to even get tested, as if they test positive, they could lose their jobs and be unable to pay their rent. Now, tighter labour discipline aimed at boosting profits in response to the capitalist crisis has also been enabled by a reduction in the apparatus to enforce workers' rights. Looking at the background for this, in the year from 2009, under the last Labour government, the government spent just £8.8 million enforcing the national minimum wage, employing 93 compliance officers across the whole of the country. Compare this to the money spent that year on border enforcement, £248.6 million spent that year for the UK border force, and an additional £884.3 million for in-country immigration enforcement, employing 7,500 staff in the local teams of the UK Border Agency. This speaks volumes for the priorities of the British state and the Labour government of that period, which is all about controlling workers, disciplining workers, and only paying lip service to upholding workers' rights. Since then, the number of local authority health and safety inspectors have been severely reduced, from 1,020 in 2010 to just 390 in 2020. And Britain has one of the weakest labour inspectorates in Europe, with less than half the number of labour enforcement officers that is recommended by the International Labour Organization relative to the size of the workforce. Today, this has contributed to a situation where 1 in 9 workers are being forced to return to unsafe workplaces. There were more than 500 recorded outbreaks of COVID just in offices in the second half of 2020, as well as many in other workplaces. Yet out of 97,000 official complaints of COVID-19 workplace safety breaches that have been made, only 0.1% led to an enforcement notice. Housing has also played an important role in how the pandemic has played out in Britain. With high concentrations of people in the private rented sector, many in homes of poor quality and overcrowded, this has created perfect conditions for the virus to spread within households and has made it difficult or impossible for some people to properly isolate. This is a consequence of the steady reduction in state-subsidised council housing since the 1970s, driven by the so-called right to buy for council house tenants, and more recently also housing association tenants, in which the state heavily subsidises the cost of purchase. This has led to large amounts of state-funded housing passing into the hands of private landlords, and councils have been barred from using money from council house sales to build more housing. Over time, a lot of former council housing has become concentrated in landlords' hands. In London, more than 1/3 of former council housing stock is now rented out privately by landlords. This forces many people into private rented accommodation, however poor the conditions, because there is no alternative available. Conditional welfare, insecure work and overcrowded housing are all particularly prevalent among Black, Asian and migrant sections of the working class, contributing to the higher rates of infection, illness and death among those sections of the population during the pandemic. The university sector played an important role in driving the second wave of infections following the return of students to university last September, and so also needs some mention. Many people have argued that this was motivated by universities' desire for students' accommodation fees. In at least some cases, this may well have been a contributing factor, particularly given that much of the accommodation that has been built in recent years was financed with private loans, and so universities rely on students' rent to finance the interest. However, there are also deeper issues at play. When the government slashed teaching grants in 2010 and replaced this with higher student fees, they created a situation in which universities are forced to compete with each other for student numbers. And this has shaped their response to the pandemic, scrambling to do whatever they think will keep students from switching to a competitor university, even if the outcome of this has been inconsistencies and U-turns that have actually angered many students. If we turn to the NHS and the social care system, their ability to respond to the pandemic has been fatally undermined by years of cuts, fragmentation and outsourcing. Private finance initiatives, where the state takes out a private loan to build public buildings to be paid back with interest, were signed by the last Labour government to finance hospitals, creating debts that have combined with funding cuts in more recent years to lead to a protracted crisis in finances and a crisis of staffing, with 100,000 unfilled staff vacancies across the NHS, including 40,000 nursing places. Total PFI debt was £300 billion by 2016, equivalent to 2.5 times the NHS annual budget, for construction projects that only cost £55 billion. So this leaves £245 billion to be transferred from public funds to private profit in order to build £55 billion worth of buildings. Repayments on these debts have forced many hospitals into states of crisis, leading the Royal College of Physicians to warn that some acute care could be on the brink of collapse. In the winter of 2016 to 17, the British Red Cross declared a humanitarian crisis in the NHS, after it had to step in to supplement state provision in 20 accident and emergency departments. Sustainability and transformation plans were first announced in 2015 and have been drawn up across the country with the aim of cutting expenditure, driving a process of rationing. In social care, the majority of provision has been privatised since the 1980s. Care companies have expanded and have been taken over to an asset stripped by private equity firms. This has contributed to repeated crises in the sector and deteriorating conditions for many workers and service users. Cuts to local authority funding since 2010 have reduced resources for social care, which has in turn increased demands on the NHS and put pressure on care providers to push down their costs by reducing services to the bare bones and squeezing their staff till they drop. The NHS and social care have both been hit by funding cuts in the years leading up to the pandemic. Between 2010 and 2014, despite growing demand, health spending increased by only 0.41% per year, and social care spending fell by 1.57% per year. Those are in absolute terms. When taking into account inflation, those are real term cuts for both health and social care spending. And this was unevenly spread. In the poorest communities, social care spending fell by 14% in real terms between 2010 and 2016. And this cost lives even before the pandemic. An article in the British Medical Journal in 2017 estimated that recent funding reductions were associated with a reversal of previously falling death rates, such that 45,000 more people died between 2010 and 2014 than would have been expected based on previous trends. With the arrival of the pandemic, outsourcing in the health sector has presented lucrative opportunities, especially for those with connections to the government. £22 billion has gone to the private sector for the shambolic test and trace system. £10.5 billion so far has gone to PPE and other essential supplies, all without a competitive tendering process. Many of these private contracts have gone to companies that are run by people whose connections with MPs enable them to get on the high priority list of suppliers that have been 10 times as likely to be awarded contracts. Just yesterday, a court ruled that the Department of Health acted unlawfully by not publishing details of some of the contracts it has signed during the pandemic. Of those contracts that we do know about, many of those providers have no relevant experience and fail to deliver. For example, Ayanda Capital, which received £155 million for 50 masks which then had to be binned because they were substandard. There was no refund. Or PestFix, a pest exterminator company, which received £350 million of public contracts, including the supply of 600,000 masks, which again failed to meet the required standards and had to be thrown out. Private healthcare has also done very well from the pandemic, receiving £1 billion at the start of the pandemic to allow the NHS access to its beds as overflow for non-COVID emergency treatments. And private providers have received another £10 billion to clear some of the recent NHS backlog. Yet while all of this money has been made available for private providers and their shareholders, the increase in NHS funding has been negligible. The Health Service Journal reported in December that out of requests hospitals have made for £567 million in additional funds since the start of the pandemic, £335 million worth of these have been rejected or have simply gone unanswered. And the £500 million that was spent on the Nightingale hospitals was wasted because there was nobody available to staff them. To address the staffing crisis in the NHS, the government put out a call for former staff to return, but again, they outsourced this time to Capita, the company that was named the worst large employer in Britain in 2009 and was made responsible for this urgent recruitment task. Applicants through Capita for this scheme have had to wait an average of 26.5 days for Capita to even do anything with their applications and pass them on for processing. And by November, out of 73,000 former NHS nurses, only 1,007 had returned to the service. Although the NHS has been severely weakened and atomised by all these attacks over recent years, still, where it has been allowed to take the lead, as in the vaccination programme, it is proven to still be far more effective than private provision. The last important piece of background we need to take into account is the political landscape. Historic defeats for the working class in the 1980s, within Britain and internationally, contributed to the development of a highly individualistic and reactionary petty bourgeois layer of society, which provides an important base for the populist politics of the Johnson government. At the same time, the intensifying crisis of capitalism and Britain's relative decline have made the kind of concessions to the working class, which were offered by social democracy in earlier periods, impossible today. The abject failure of Jeremy Corbyn to even mount serious opposition, let alone leave a lasting legacy from his time as leader of the Labour Party, underscores the death of social democracy. Yet a revolutionary alternative to this has still not emerged, and with the notable exception of last summer's Black Lives Matter protests, the government's horrific handling of the pandemic has met very little progressive response. The government's base in populism has meant their pandemic policies have blown in the wind, adapting to whatever this week's focus groups are telling them about voter opinions. On the streets and in communities, reactionary populism has promoted conspiracy theories and built an active movement for non-compliance with public health measures, although the high take-up of the vaccine so far suggests that this may be having limited influence, at least among older people. To conclude, the government's ideological commitment to the private sector has its roots in the class interests that the Conservative government and their loyal Labour partners represent. The ground for the current disaster was laid long before by the desperate attempts of the ruling class to shore up the failing fortunes of British capital. It is very clear that no real opposition is going to come from the Labour Party. Starmer has stuck to his policy of constructive engagement with the government throughout. It is up to all of us to build real opposition ourselves, and that can only be done outside of the Labour Party and where necessary against it. The pandemic has shown more clearly than ever that capitalism has no solutions to the problems facing humanity. Under capitalism, human lives will always be seen as a price worth paying to keep business going. For a society that is worth living in, we need to break with this decaying capitalist system and start to build a society that is based on cooperation to meet the needs of everyone. That is socialism. Thank you.
Woo! Thank you, Tom. That was amazing. You got through a lot of really important and in-depth background kind of context that I think is really, really useful and really important for us to understand, so that we can get a sense of that it's not just a case of some sort of Tory corruption in and of itself that's created this disaster, but I think you showed that it was it's kind of running through the entire decaying British capitalist system. We had a good question earlier on